Well, it is a National Poison Prevention Week, and experts say that more than 2 million poisonings are reported each year. Joining us this morning is Amy Hanoian-Fontana. You are the Community Education Specialist at the Poison Control Center at UConn Health. So first question for you is 2 million. That is a huge number. How big of a problem is this?
Poisoning is a big problem. It's actually the #1 killer in unintentional injury, and it's something we don't talk about that much. I think poisons are all around us and we can learn how to be safe with them.
And you brought a lot of the examples, so why don't you just take us through the different ones?
Yeah, so today we're going to talk about the top 5 poison hazards in your home, really groups of things. So our first group over here is medications, and when we talk about medications we mean herbals, naturals, supplements, prescription, and over-the-counter, especially analgesics. So those are things like acetaminophen, ibuprofen, naproxen, etc. And we see a high incidence of teens getting into analgesics, or pain relievers, if you will.
Wow. And why is that such a big problem? Because it just affects the liver and makes it go into overdrive?
That, and just think about the commonness of it. We all have pain relievers in our house. Even if we're not a person that takes a lot of medicine, we generally have some kind of pain reliever for aches and pains, fevers, headaches, that kind of thing.
What's the next one?
Then our next group of things is cosmetics and personal care products. So many of these are non-toxic. Like think about a 2-year-old eating a lipstick or getting into some blush. Okay, we're not going to worry too much about that. But there are some toxic items in this group. For example, we have alcohol, whether that's perfume or aftershave or even hand sanitizer. Hand sanitizer is 62% or greater ethanol, which is alcohol, so it cleans your hands, but we don't want a little one to ingest that. And we also have a problem sometimes with powders. Believe it or not, there's different kinds of powders out there. If you ever check your labels, powders with talc are more toxic than powders made with cornstarch. And the reason is because talc can get, you know, into the nose and into the lungs and can cause this coughing and a chemical pneumonitis.
And what do you do? I mean, we see baby powder on changing tables. What should you do to make sure that, you know, you're not accidentally poisoning your kid?
So the easiest thing to do would be to buy the powder with the cornstarch instead of the powder with the talc. That would be the easiest thing. Okay. And the next thing is not to give the bottle to the child to play with, which is hard when you're changing a diaper.
Right, trying to keep them occupied. What's next here? This looks like cleaning products.
Right, so we have lots of cleaning products here, and they're so varied, we really need to call the Poison Center if you get exposed to a cleaning product. Okay. But I want to focus on one of our newer trends, which are these laundry pods or these single-use laundry detergents. I mean, look at those exquisite colors.
At the bottom
Pink,
there, yeah.
Orange, blue, they're juicy, they're squishy, they're appealing. And because they're so super concentrated, we're seeing some real issues in kids, like maybe even having to put a tube down their throat to help them breathe. And that's pretty serious stuff in the poison world. So to be really careful with those, make sure that those are locked up and high so that kids don't get into those.
Right, and they're so, I mean, they're so easy to also open. You know, they are covered in the plastic there, but you know, they pop open in the wash, so they can pop open.
Exactly. A little squish, and there it is.
Then it's done. Yeah. And what about these are actually, you brought something that I went, ooh, when I saw it. Tell us a little bit about this category over here.
So the next to the last category is foreign objects. So these are things that kids put in their mouth, you know, that to us would be totally gross out factor. Right. Sometimes they're not a problem. For example, store-bought Play-Doh, silica gel, you know, when you get a new purse, a new shoes, vitamins. But big problem is button batteries. Now, they will burn. If you think of that hot dog there as a child's esophagus, the length of the esophagus, and we put a button battery in there for a couple of hours, just a couple of hours now, and it burned through that. You can see the black, the charring, and that's pretty bad. You know, that would need a higher medical intervention for a child who swallowed a button battery.
All right, and just last thing for you right here, what are these?
Things in a tube. So topical preparations, many times they're not a problem. The one real problem in that group is the mouth numbing cream, the Oragel or the Ambisol. That can cause a methemoglobinemia, which means baby can turn blue because they're not getting enough oxygen in their body. So that is a serious one. Usually things in a tube are minor.
All right. Thank you so much for joining us and informing us about all these things that we have in our household. We really appreciate it. All right, and still ahead, if you have more questions or need more information, you can always contact the Poison Control Center. That number is 1-800-222-1222. It also is free and confidential.